The title of this study is Outpatient versus Home Management Protocol Results for Plantar Fasciitis. And this can be found in the American Orthopedic Foot and Ankle Journal. And they looked at combined physical therapy modalities, including patient education, stretching, strengthening, myofascial release, and soft tissue mobilization, and whether they're better than home stretching and strengthening exercise programs only for patients with plantar fasciitis.
A little background on plantar fasciitis. So plantar fasciitis is degeneration or micro tears of the plantar fascia, usually near the origin on the calcaneus. The etiology is not fully understood, but some possible risk factors include individual anatomy, which we know can also affect biomechanics. So thinking about things like hyperpronation, hyperextension of the hallux, limited dorsiflexion, or a leg length discrepancy. Anthropometric factors such as high BMI can also be a risk factor. And as well, there are lifestyle factors such as participation in sports or occupation. And then finally, age greater than 40. A classic symptom of plantar fasciitis is pain on the bottom of the heel with the first steps in the morning or first steps with activity. And it may get better once the person is up and moving, but then it will get worse as the day or activity goes on. Pain is generally relieved with rest, but once they get up and moving again, they'll likely have that pain with the first steps. For interventions, you can see the clinical practice guideline recommendations listed here, as well as a few things that are not recommended. And as far as literature, a systematic review in 2017 showed strong evidence for stretching exercises, and a randomized controlled trial from 2014 demonstrated good outcomes with myofascial release for pain and functional disability. For our search strategy, the database used was PubMed. Our search terms were plantar fasciitis and interventions, and we wanted randomized controlled trials with a publication date in the last 5 years. These parameters gave us 71 results, and the article we chose was Outpatient versus Home Management Protocol Results for Plantar Fasciitis.
So this study had 47 participants with 53 total feet, and they were randomly assigned to an outpatient and a home group. So the home group just did the home exercise program 7 times a week with follow-ups every week, and then the outpatient group did home exercise program 7 times a week along with myofascial release to the gastroc, soleus, plantar fascia, soft tissue mobilizations as well as joint mobilizations 2 times a week with the same PT every time. And then an example can be seen on the following slide of one of the techniques used. So for data collection, they did pre and post questionnaires, face-to-face interviews, VAS, FFI, Y-balance test, range of motion and all the axes of the ankle movement, and monofilament testing. And then they did a pre and post comparisons at the 8-week and the 6-week mark. For statistical analysis, they use independent sample t-test for normal distribution, Mann-Whitney U test for non-normal distribution, and the p-value is set at less than 0.05. And then the results can be seen in one of the following slides highlighting the areas that provided the greatest difference between the two groups. So this study showed that a combined approach is better than just exercise alone for patients with plantar fasciitis. Some of the strengths were that it was randomly controlled. The patient education was provided for all patients, so it was all the same. And they had detailed all the manual therapy that was used, including the exercises, the soft tissue, and myofascial releases. Some of the weaknesses, though, were that the home exercise group was not supervised as much as the other group, and then we don't know the long-term results. Conclusions we gather is that combined interventions are more effective than just the stretching and strengthening only. And then